Hello, everybody.
Hi, everyone. Hello, everyone. Today we're doing low back pain. This is an iconic one, right? Low back pain.
Oh yeah.
It's the main one.
Yep, that and neck pain.
That's it. Those two are major ones, right?
Yep, bread and butter.
Our bread and butter, and it's so great. You can get rid of almost every back pain. It's going to be like just by treating these muscles. So that we're going to look at today. We're going to evaluate them, look at how to check them to see if you have trouble with them, then how to treat them yourself. As we're going to start out with today, and we usually do a three-part process. We heat, then we evaluate, treat, and then we move. So that's how we do it.
All right, we've got Florida, Grand Rapids.
We do?
Everybody coming on? Yep.
Florida, Grand Rapids, Michigan.
Yep.
Great.
All right. So low back pain. What is there? Probably one or two muscles or something.
Yeah, a couple of muscles.
Dayton, Ohio. Welcome. Thank you.
Hi, Dayton, Ohio. Okay, so here's some of the muscles, Justin, that cause low back pain.
What pain key is it?
Well, this is pain key 16.
16?
So you can take a look at that. So that's protocol 16, and those are all the muscles that cause pain in protocol 16.
Right there, 16 low back. Oh, there it is. Sorry, right there. Right by the low back there, 16. So it's not too bad. It's not too bad. Iliopsoas, longissimus thoracis, iliocostalis lumborum, and thoracis, multifidi, rectus abdominis, and gluteus medius.
Yeah.
That's a lot.
Broadcast, it was all dark, remember?
Yeah.
It's all dark, yeah. Okay, so all the muscles we're going to look at today refer pain to the low back, right?
Yep.
And some of them are right in the low back and some of them aren't, right?
Right.
Yeah, it's always true. So the most likely one is the iliopsoas.
Oh, yeah.
Yeah, the iliopsoas. Now, that muscle is in the front of our body here, but it causes pain in the back. Isn't that incredible?
Yep. Well, let's see.
Here's one of them. Here's a nice picture of it right here. So here's the iliopsoas. See how it attaches onto the spine in the front, and then it comes down. So T1 all the way down to L5, and then it comes and attaches on the inside of the hip, the ilium, and down attaches over here onto the humerus, onto the femur, I meant to say. And then here you can see the pain that it causes in the back. It causes really bad back pain, and if it's both psoas, you might feel it across. But most of the time, when people complain about psoas pain, they usually say, "Look at me for a second, Justin." They usually say, "Oh, it goes up and down like this." Okay. Now the fifth most likely one is the abdominals, and when people feel that one, what do they usually say?
It's across the back.
Yeah, they usually feel like, I feel it either here, across here. Oh, I always feel it right here. Or they always say, oh, I always feel it like this, across.
Yeah.
So that would be the referred pain, and that's another muscle in the front that causes pain in the back. Again, let's look at that one. So here's the abdominals attaching there at the xiphoid and there at the ribs, and then down here attaching at the pubis and onto the all the way down here into the pubis there. Now it causes pain here. Look at in the low back, really low, over the sacrum and over the glutes, and over here right underneath the scapula. Oh, a little louder, right above. Okay, right underneath the scapula, across, and right below the ilium, right there.
Yeah.
So that's where they cause. So those are two muscles in the front that cause pain in the back.
Yeah. Well,
Yeah.
the iliopsoas, remember, is going to be behind all the intestines and everything. So
Right.
to get to that muscle, we're going to have to go around and beneath. It's attaching to the anterior parts of the transverse processes on the vertebra. So it is in front of the spine, and then it wraps around in front and attaches on the front
Right into the
middle.
lesser trochanter of the femur.
Yeah, right into the lesser trochanter of the femur, right there. So, and it causes this leg to bend up and get you into that seated position. It's one of the major hip flexors.
So what would be a really big underlying perpetuating factor? What do you think would be a really big underlying perpetuating factor, Peter?
Posture.
Could be posture, right? What do you think a really big underlying perpetuating factor is?
Driving.
Driving. Yes, yes, it is. Yes, yes, it is. Yes.
Constantly.
What do you think, Justin?
Well, just about any kind of over, extended period of sitting.
Sitting. It's
Yeah.
mainly sitting. Sitting. So let's stand up.
Okay.
Let's get up. So let's get out of the seated position. But those that sit the most died the youngest, and they found that they died how many years younger? 10 years younger.
Wow.
And no matter what you do, it doesn't change that. No matter how much exercise you do. Besides, if you sit 8 hours a day, during the day, it also causes the major cause of low back pain.
Oh yeah.
So we're gonna do a test to see if it's bothering us, and we're gonna test all the other muscles and see if they're bothering us as well. Let's look at a few more referred pain patterns. So did you see the referred pain patterns?
No, not.
Let's take a look at them. Yeah. So
So
the
we saw
first one.
iliopsoas,
Yeah. Let's take a look over here.
and we've got the longissimus.
Okay. So here's the longissimus here, and the longissimus right here. This is it right here, and there's the iliocostalis. And you can see that they cause pain into the low back and into the glutes. So here they causes it into the low back and into the glutes. So this is the iliocostalis, and this is the longissimus. So these muscles here, they're over here.
They just run up and down along the
And
entire
they
length of the
extend.
spine there.
You use those to extend your spine. So let's all of us. Yeah, we got another picture of it over here. It doesn't have the referred pain pattern.
Right.
Okay, so this is the muscles that we use to extend our back like this. So we use that to extend. Let's all of us extend. Let's feel those muscles extending. And the psoas muscle, let's do one of its things. We use that to lift our leg. And this also we use it to bring our torso down. So those are a couple of its jobs. And the iliocostalis, a nice test for that is the standing toe touch or the seated toe touch with the legs out in front of you. Those are good. Now another muscle that we're going to look at is the multifidus here. So this is the referred pain pattern of the multifidus, but interestingly enough, they can also cause pain in the front, right where the abdominals are. So in the psoas, so you could potentially have the multifidus causing satellite activation of the psoas and the abdominals, and the psoas and abdominals causing satellite activation of all the paraspinals.
Now, most people, when they treat low back pain, they're going to work on this. They're probably going to treat these muscles here. They're going to work on the the paraspinals and the multifidi. So that's good. So you already know probably a lot of how to do that. So we'll teach you a few tests for those. But most people will overlook the psoas.
It's going to be really important to look at the psoas and the abdominals. So
Yeah.
I was at a conference of Trigger Point doctors in Las Vegas. And I said to every doctor, I said, they all had back pain because there was a conference. They're walking. So I said, what if we just treated your abdominals to see if your pain went away? And every single one I treated, all their pain went away if I treated just the abdominals. So that was so it can be very important to treat the abdominals. But I find that the psoas is the most likely to cause the trouble. But
Yeah.
maybe it's toss-up, but they're both really, really, really something.
All right. So
And the last one that we didn't talk about yet is the gluteus medius.
gluteus medius.
Yeah, so that
That
one.
causes low back pain.
Yeah, it does. It
Everybody
causes,
know where that is?
Well, here it is. It's right here, so you can feel it. So when you turn your foot in, you can feel it kind of stretching.
Turn
When
your
you
foot
turn
in.
your foot out, you can feel it sort of bunching up. It's right here, and it attaches onto your hip bone here, and then over here onto your ilium right there. So it attaches right there. And so let's take a look at the referred pain pattern of this one. Here it is. So you can see it causes referred pain over the sacrum and over the ilium right there, and over right into the low back area. So that's the referred pain pattern from the gluteus medius right here. So we're going to have a nice test for that. And so a nice range of motion test for a range of motion is to walk with your toes in and toes out for that one. So we'll do that today. We'll do some nice range of motion exercises. So that one causes low back pain. And so we're going to test to see whether or not we've got, so the reason we test is to see if the muscle's short. So if the muscle's short, it's most likely got trigger points in it. And then after we look at the ones that are short, then we're going to palpate them to see if they have any taut bands and if they're tender and if they cause referred pain to the area in the low back. Yeah. So that's what our plan is.
Okay, and that's it, huh?
Yes.
Not bad, not bad. So,
we have some new people here.
Yep.
We have Peter, and
Hey, Peter.
he's had some he volunteered to be our patient today, and he's had a little bit of low back pain. Sometimes you have pain on the left side, right?
Yeah.
And you said sometimes it goes down the leg. You said, right?
That's right.
Right. So one of the things we're going to look at is an underlying perpetuating factor, which is not being symmetrical. So let's take a look at that
What
first.
does that look like, guys? What muscle?
What muscle would cause that?
Right.
What muscle would cause pain right there on the left side?
Does that look kind of like?
What do you think? What muscle?
Was that the first one?
Peter
Yeah.
thinks it could be the first one.
The first one, exactly. That psoas muscle, right
Yeah,
there.
Peter thinks it could be the first one.
Could be the first one. So,
All professions are like that nowadays. So we're going to take a look at and see what we can do to help you with to contradict the sitting, and help you with any pain that you might have. So you had a goal of preventing low back pain. I love that.
Yep.
That's nice. We're going to have all our joints working, right? Every joint, and prevent low back pain, right? That's what I like. And also better posture, and that would be great. That would be great. So both of those are really good goals. I love those goals. So also sometimes you said you have a little pain in the thigh right here. So
Yeah.
right here,
Yeah,
right there.
Yeah.
What does it feel like right there?
It's not exactly pain. It's more like kind of tingling.
Aha! Tingling!
well, doesn't that look like the psoas also having something in the front
there's
there?
something very important there. The iliacus, part of the psoas, so the psoas can compress a nerve right here that then causes it to be tingly right here. So we're going to probably find that nerve, that muscle that presses on that nerve, and correct it.
Good.
Is that great? Muscle in every fiber. Okay, get it all working. All right, so let's take a look at you from the back and see if you're symmetrical. You see we're kind of a little bit rounded here. So this would be some of the posture that'd be good to work on, right?
Uh-huh.
And then also, if you could look here, if you put your fingers on the scapulas, you see that the one scapula is lower than the other scapula. So
Right.
this left one is lower than the right one. So a lot of times I just draw that. So this is today. This left one is lower and that one's higher. And then we might look at your hips and see how the hips look, and see that they're pretty even. So that's good. So it just go show that. So then these muscles here somehow, or this muscle here is it could be too short, pulling it down on that side. So we'll check it and see what happens. Let's look at him from the side. And the head's just a little forward, yeah. So those are things to be looked at there. Now let's take a look at your feet. So can I take a look at, can you roll your pants up so I can look at your ankles a little bit? Great. Okay, so you like to turn that right foot out quite a bit. Let's take off your shoes and let's look at you without. Maybe it's different without. So we'll look at your feet just for 1 second. And we could treat the muscles first, and then we can go back and look at your underlying perpetuating factors here. But you can see you have a little bit of the Morton's foot and a little bit of first metatarsal deficit. Yeah.
Okay.
Yeah. So I'll just measure it for you a little bit. Do you want to give me some blue things? Okay, so let's go ahead and make your feet straight. Okay, so if you make your foot straight, you see that the ankle is a little bit. So your ankle should be about here like this. So that puts your foot off the ground like that. So now we're going to take up the space and bring the ground higher to your toe. Okay, and let's see on this side.
So this is what we were doing last week, and we're going to have a whole class on this, but she's looking for perpetuating factors that might cause the muscles that affect the low back to become dysfunctional, such as this first metatarsal deficit right here.
Mm-hmm.
His ankles were turning in, and his foot was dropping inward.
And he turns his feet out.
So that's a good sign of Morton's foot, which we talked about last time.
Or hyperpronation.
Yep.
If you want to call it that.
Yep.
Okay, so we wanted to see if it's going to change the back, okay?
So let's see
So
if
here
it's
we
changing
wanted-
the shoulders.
So it does change the shoulders and it makes them even. So that's good. Let's also look and see if it, put your head straight and just see if it, and here it makes the ears go back just a little bit. So
Yep.
it's probably good. So it looks like we probably want to put in 3 millimeters or 6 millimeters. Maybe start with 3 millimeters and maybe go to 6 millimeters and correcting, like put a little lift in your toe there. Okay, so that's good. Let's take a look at another underlying perpetuating factor. Let's look at a heightened tone in the muscles. And today we want to look at the heightened tone in nerve roots L1 through 5 and T5 through T12. So let's particularly look here. So here we're very tight in the lumbar. Yeah, very, very tight, like almost like T11 through L5, very, very tight. So that would be good to treat the little muscles along the spine. Okay, so those are going to help to keep the psoas and everything in good shape, the abdominals and all. And
So
all that.
she's finding that there was hypertone of the muscles in the areas where the nerves go to the muscles. So the nerve that goes to the psoas in the lumbar spine might have some impingement there because there's excessive tone of the paraspinals in that area and the skin in that area. So that shows that there might even be some nerve issues. So we definitely got to have to treat the paraspinals in that area of the spine in order to make sure that there's a proper nerve flow to the psoas muscle.
Great, thank you. Okay, so today we're going to be highlighting the trigger point therapy for low back pain book, and so you can get on for those now. So we created this book a few years ago, and it's you can get it on Amazon. And how much do you think it costs on Amazon? 17, 20, somewhere between 17 and 20. Yeah. So here's everything you need to know about fixing your low back. This one here. This is your trigger point therapy for low back pain. Black, so which is nice. And then the one in Japanese is really nice too. So okay, so so everybody, let's test each other and let's test ourselves to see if we have any trouble with any of those low back muscles, the muscles that cause low back pain.
All right. So which range of motion tests are we doing?
Let's do a few of them. Let's do a few. It's some really. Let's start with the psoas and let's do a few great range of motion tests. Okay, so you got them there for me? Great, thank you.
So remember, guys, on this chart right here, it has the range of motion test right after the muscle. So if you go to number 16, and it says range of motion test number 31, 34, and 48. So you've got 31 right here. That's the psoas test we showed you last week. Remember that the knee has to drop below the below the hip, and then we've got number 34, which is the knee to armpit test. We did that again last week too, where the practitioner or you bring your own knee up to your armpit. And then number 48, which I think we're not going to do 48. It's not one of Sharon's favorites, so a coffee table test, but you can learn it. But that's not one of her favorites. That's more for the external rotation role that the psoas plays. Okay. All right. So
I'm going to start today with the psoas, the most likely cause of low back pain. Is that okay?
Yeah. If all you did was treat the psoas, you could have a whole practice based on just that.
Yes, we could. Femoral nerve that's causing his nerve compression there too. Okay, let's have you go ahead and lay on your back and put your head there on the pillow.
And the Morton's foot is going to cause his condition to come back even after we treat it, so that's why she checked for that.
So if you're leaning to this side, these muscles here are more likely to be short, and those muscles here would be very likely to be causing the pain here. But also it could be the psoas muscle causing the short, pulling you down, causing the pain here. And it also could be the abdominals pulling you this way. It goes in pain there. So a whole bunch of different muscles.
Okay.
So we're going to measure so you can do this every day in the morning or in the evening. Just when you get up in the morning, you can check and see, oh, is my psoas in good shape? You know, you can see, and then you can go and check it. So let's go ahead and bring your knee up towards your chest. And then it's not going over this way, but you're going towards that side, okay? And relax, so you're not pushing it very hard. So this is the test. The test is like a light push like that.
Okay.
And you can see, it doesn't, I know I could push it further, but then that'd be substituting. Right here, this is the muscle. It's a diagonal muscle in here. And we're testing the ability for it to shorten. And that's 11 inches, and we'd like it to be more like 5. Okay, so we'll see if we can get it down to 5.
So
today,
that's obviously a very positive sign for the right psoas being very tight.
Yeah, too tight. Yeah, so we can get that to be better. So that's very likely to cause pain. And then here, this one's a little better on this side.
Not quite as bad on the
So
left.
relax for a second. So it's like a passive test. So it's like me doing it, but not you actively doing it. Okay, and that's 11 inches too. So we want to get it down to like 5.
Okay.
Okay. Also, another test that's for the glute medius is turning. This one here is the toe turning in test. So let's see how you do with that. So this is the toe turning in test, and you can see, oh, it doesn't turn in so good. Okay. So here's the toe turning in test. It turns in a little better on that side here. So let me do it. Okay, relax. Okay, it's better on this side. Yeah.
So that's for the glute medius?
So this is for the glute medius, and for the glute minimus, and for the other deep lateral rotators. It's all of those babies. So it should just flop down and touch the table.
Yeah.
So on this side, it's minus 2.5 inches, and on this side, oh, it's a little stiff on this side. It's minus 4 inches on this side. So this side, oh, it doesn't want to go that way. Yeah. So this side needs a little bit more moving.
So what test was that?
So that's the Freiberg's test. Oh, I know it by the name of the Freiberg, but we'll find which test it is. Okay. Stephanie, help us. Which test is it?
44, 45, 49.
Okay. So we'd like to be. So you got it. So we're supposed to be able to rotate the toe all the way, and it should touch the table. Okay, just from here. And this is the side that has the. This is the side that has the nerve compression, right?
You see the glute medius right there? Test number 45.
This is the side, yeah.
Because
so this muscle here
chart,
does that job.
45.
Okay, so this part of this muscle
and
right
that's
here.
That internal rotation right there.
Yeah. So the lateral cutaneous femoral nerve gets compressed by the muscle that doesn't the psoas, which needs to bring the foot this way. You know, so it won't go that way either. So if we can get the foot to go all the way in, probably he won't have that nerve compression right here of the superficial lateral cutaneous femoral nerve. That there, yeah, right there. Okay, so that's it'd be so great not to have that. Okay, so we found a couple things. Let's do the seated toe touch.
Okay.
So let's go ahead and have you sit. Okay, great. And now scoot back a little bit. And let's go ahead and have you go ahead and touch your toes. And that's a pass. That's a pass on that one. Great. Okay, so you passed on that one. Okay, so we'll do one more.
And which muscles would that be for?
That would be for the paraspinal. So that's like all the muscles on the spine. Yeah, all the muscles. So that'd be the longissimus, the iliocostalis, and a little bit of the multifidus and rotatorius. They do some of that as well. Also, it tests his ability for the abdominals and the psoas to contract, which he's able to do. So that's good. He's kind of got minimum fitness there, at least. That's good. Okay.
Yeah.
All right. So did we hit all the?
Well, we didn't do the Thomas test.
Oh, let's do the Thomas test. Yes, let's do it. Yeah. Let's come over here and stand at the end of the table, and I just want you to like sit really close to the edge. And I'm going to have you hug one leg underneath like this, and then you're going to come back, and then we're going to see we're going to do the little test now.
Just gonna get my
Yeah. Oh, good. Oh, good. Okay, get right next to the edge there.
And then we didn't do the...
sit more like, no, don't sit, yeah, just get right at, grab one leg and go underneath the knee like that. So everybody try this at home. Okay, go ahead and let's go back all the way like this. Keep coming back. And let's see, put your head rest. Here, I'll give you a little spot for your head. Okay, so here, You see it's a little bit a little tight, but also you can see the quads seem to be tight. Can you let go? Yeah. So his quads are very tight here, so it shows that his knee muscles are tight.
This should be able to go if you're
Correct.
relaxing at 90 degrees.
Yeah, it should be more like 90.
And this should be. It's not too bad.
It's not too bad. Yeah, it's showing that the psoas has almost most of the ability to stretch.
Good.
Okay, let's see on the other side. So let's go ahead. So on the left, it has most of its ability. Okay, let's go to this side. Oh, yeah, go ahead. Do it that way. Yep. And come on back. Okay, see on this side, same thing. It's good, but it's also could go down a little more, and you can see this. The knee muscles are a little tight.
Yeah.
So the psoas has most of its ability to stretch. So that's pretty much of a pass.
All right. So guys, for the psoas muscle, it needs to lengthen all the way. That's the test we just did.
And it needs to shorten all the way.
And it needs to shorten all the way, which was the knee to the armpit test. So when you're testing for the psoas, you do this test, which what's this one? It's got a funny name again.
Oh, the
Thomas test.
The Thomas test and the fibers test we did today.
So the Thomas test, you grab the knee and you lean back and you watch to see that the knee falls below the midline, and then to shorten all the way, you do the knee to the armpit test, and it should be up to 5 inches from the sternum when you hug your knee to the opposite shoulder.
Okay, so we were going to treat ourselves. What do you think about that?
Sounds good.
Sounds good, everybody. So you need a few tools. So yes, today we need a few tools. We'll need back knobbers today, like we have had, and we'll need a nice tool like this. This is a great ball. This is about the size of a softball. It's about the size of a child's basketball, maybe. So it's kind of a small ball. Now this ball is about the right hardness for you, but some people it might be good to start the same ball, but really, really, really soft. So like this, so a soft ball like that. Or sometimes you might want to go a little bigger and do a ball this big or a ball this big. So if it's too painful to use the smaller ball tends to be more pointed, and the larger balls are less pointed. So if it's too painful to use the smaller ball, then you would use a larger ball or a softer ball. So you go that way. So so in the book it tells you how to do the beginner's way, the intermediate, and then the more advanced. Today we're going to be a little bit more on the advanced side than on the. So let's first treat the psoas, and let's see what happens. Okay. So would you? We could do it right here on the treatment table. So I'll move this soft pillow and my little neck pillow. Okay. So let's go ahead and have you laid on your tummy, and let's look at a picture of the psoas. All of us. I'll show you a picture of it. Lay sideways and face towards the camera. Okay, so we're going to take a look at the psoas, and here's a nice picture of it right here. So here's the psoas attaching onto T12, L1, 2, 3, 4, 5, and down here onto the femur, onto the lesser trochanter. So it brings the knee towards the chest. Oh, what's another really bad underlying perpetuating factor would be, like, get into the fetal position, like if you're sleeping, bringing your knees. Okay, so like in this head forward like this, and then the arms kind of like this. This is like the worst positioning for getting rid of low back pain, because what happens is you're sitting all day, and then some people are sitting all night too. See? So this is sitting all the time. And then they're sitting while they're driving, and then they're sitting while they're on the bus, and then they're sitting while they're eating. So they're sitting all the time. So what we want to do is take people out of the fetal position and unbend their knees. Doesn't have to be straight, but everything unbend, so that while you're sleeping, that you're actually getting rid of some of the dysfunction that you're putting in all day. Okay? Okay. All right, so now we're going to feel the psoas muscle on this side. So we're going to feel the belly button, and then we're going to come just to the outside of it right there. Then you're going to put your weight on it like this. And then you put as much weight on it as you can put on without it hurting. So how does that feel?
It's okay.
Does it feel a little bit painful?
Yeah, a tiny bit.
Yeah, so you go right to where it feels a little bit painful, and then you hold it. breathe and relax. So what you're doing is you're pressing on the taut bands that are in there, and you're pushing the painful chemicals out of the taut bands. Now, different ways we could go ahead and look at the muscle in different ways, but this is one really good way. So we're looking at the muscle, and then we're pressing right onto it, and we're looking for painful spots and taut bands in the muscle. So, how's it feel when you're doing that?
That one's okay.
Okay, so you press a little bit more directly onto it like that. How's that feel?
It's still okay.
So let's see. Let's go down a little further. Now, is this side the side that your back usually hurts on?
My left side.
Oh yeah, I thought so. Yeah, but this side was tighter when we tested it. The different muscles were a little tighter.
Okay.
So I was just wondering if you wrote the wrong thing on the picture.
No.
You did. No, he was right. He was right. Okay, then you come this way. So we're right on the right on the psoas, the left. So we're between the side that hurts, his side that hurts. But this side is the side that's numb, right?
Slightly, yeah.
Slightly numb.
The
right?
tingling.
Tingling.
Right, I remember the tingling.
Tingling, yeah. Okay, so we'll check that out. Okay, so then he treated really close to the belly button, then a little further down, then a little further down, and then right where the inguinal ligament is. And then if you can get really close to the femur right here, and get right where it attaches low, that's a good place to go to as well. Okay, let's go ahead. Let's try it on the other side. Let's go on this side. So let's turn over, lay on the other side. So again, you can find your belly button. Yeah, just like that. Then you're going to roll onto it. Yeah, that's it. You're going to roll right onto it. Yeah. And try to get a little straighter. How's that feel?
It's a little bit.
Yeah, so this side here, I think when we measured, was the worst side, yeah. So it wasn't the side, so this is the side we're preventing pain. So how long should you press? So if it's painful, you hold it for 2 breaths, 3 breaths, 4 breaths, 5 breaths. You can hold it for a lot of different amount of breaths, so, but at least 2, okay? So we did that at least 2, right?
Mm-hmm.
Okay, let's come off of it. So you're gonna come down a little lower here and press your body right onto it and see if you find any painful spots in there. Oh, he did. He found a painful spot. Yes, right?
Yeah.
So that painful spot. So that's a taut band in there that's probably causing referred pain to the back and maybe to the front, and maybe it's causing compression of the cutaneous femoral nerve there. So we'll see. We'll see. See how
And
that
which
goes.
side had the tingling?
It was the side that he's on.
On the left.
Yeah. Where he is right now.
On the right side?
Yeah, right here. Yeah. Right. Okay. It's this side right here. So it's his
Okay, on the right.
his right. Yeah.
That's right.
Okay. So we go ahead. And we go. Okay. How's that feel there?
Oh, yeah, that's painful.
That's the spot that would be causing the cutaneous femoral nerve compression. Yeah. So you're gonna hold it. How many breaths? If it's painful.
2.
At least 2.
At least 2.
But you could do longer. You could go to 5. Breathing and relaxing, going a little deeper, pressing a little harder. Breathing, you're spreading the fibers out, and you're pushing the painful chemicals out, and you're letting the blood supply come in. When you lift up. Okay, let's pull off a bit. Yeah, so let's try now. Let's have you lay on your back, and now see if you've got a little bit better. So let's test and see, did I improve a little bit? So you can see, oh, that was a little better. So that's a little better, isn't it? So let's try on this side. Yeah, so it's a little better. So when you do the test, it's going towards the opposite shoulder. So let's measure. Let's just measure. So that was an improvement on that test, right? What do you think, Stephanie? Was it an improvement? Okay, so here we go. So that's only 9 inches, and before we were, what were we before?
11 or
That's right, 11 we were, yes. And then on this side, so we're definitely a little better on this side. Okay, so this side here is still 11. So this one was the tighter side, but also we could be measuring our pants. Let's try the pants a little looser. Oh yeah, they're a little better. Sometimes we measure our pants. Okay, that's 10. Okay, so we got down an inch there and a couple inches on the other one. Okay, so that's our psoas muscle. We're gonna treat that now. Usually after we treat it, then we stretch it. Okay, so let's think of a good way of stretching it, okay? So let's roll to the side and stand up, and then we're gonna stretch it. And then stand up. So let's go ahead and stretch it. So one way of stretching it is just going ahead, and you're gonna put one leg back, and you're gonna put one leg back, and you're gonna, you know, like take a big step. So you're gonna take a big step. Yeah, and then you take your torso back. Yeah, and then make sure. So this is the side that's stretching, okay?
Okay.
So that's the side that's stretching. So you're giving it a good stretch, right? Good. So just taking big steps then would help a person that's been sitting a lot, right?
Mm-hmm.
So just even doing big steps would be a good range of motion exercise. But as soon as you get up out of your chair, you could go ahead and stretch, and then you could go and stretch.
Okay.
Okay, so that's a nice stretch. So there's lots of more stretches we could do, but that's a great one, you know?
Okay.
So that's a good start, just even that one right there. And then being able to take big steps and little steps. Now another good stretch for it is turning your toes out and then turning your toes in is a good contraction for it. So you can turn your toes out, stretches it a little bit, and turning your toes in contracts it a little bit. So that's a good one too. So walking with our toes in and walking with our toes out is good for it too.
Okay.
So also, you know, shortening it all the way and lengthening it all the way. So that's good because then we could do both. So when you're shortening it, you bring it towards the opposite shoulder. So shortening it all the way, and then take it back all the way, like that. Oh, back up a little bit, okay? Okay, okay, so bring it up and towards this shoulder, and shorten it all the way, and then take it back all the way. Again, shorten it all the way, and take it back all the way. Yeah, do it on the other side. Shorten it all the way, and then take it back all the way. Okay, so you got some good ideas.
Okay.
Right? Okay, now let's treat our back itself. Okay, so the next most likely one is our iliocostalis and our longissimus and our so let's treat that, our multifidus on the back. Okay, so let's do that. Let's use a little heat. Okay, give me another one. Okay, here these are great. These are Pullman type hot water bottles. Feel how warm they feel?
Oh yeah.
They feel good, right?
Oh yeah.
Okay, so let's go ahead and have you lay on your back. I think this is good. So tell me how that feels.
Very good.
So it feels good. Okay, so this sometimes when people are in a lot of pain, even touching the table or their bed with their body hurts. So this is a nice tool for many people with a lot of pain. And then it's also just nice to give a heat treatment after you've been exercising a lot, or you come home after you've been sitting a lot. This would be a nice treatment. Okay, so what we want to do is treat right along the spine, because we want to get, remember we were stiff, even all the way starting around T5, all the way, maybe all the way down to S1, you know, or T5, or to all the way down to there. So let's see if we can loosen it up.
Okay.
All right, so we're going to use our back knobber here, and we're going to come underneath and across to the other side. So you feel your spine.
Mm-hmm.
Okay, so you go ahead and do that. So you feel the spine with your tool, then come just to the other side of it. So I'm going to show you a picture of it right here, and then you can tell me if you're feeling it. So we're gonna look at this. So we're gonna be treating the multifidus right here, all the way from around T5 here to all the way down here into the S1. So you see these muscles, they attach onto the spinous process and then near the transverse process, and then down here they're more onto more medial than the transverse process, and then down here onto the sacrum. So we're going to treat those. So here, I'm showing to you, Peter. So here's the muscles that we're going to be looking at. So we're going to start about, so here's T1, so we're going to start here about T5. And you see they attach onto the spine and then onto this part of the vertebrae out here on the edge. So we're going to get into the middle and press this way and then press that way. So when we go this way, we're getting this attachment, and we're pressing that way, we're getting the other attachment. Okay. And then we're pressing in the middle, we're getting the middle part is the part that usually causes the preferred pain to the front and,
Okay.
and around. So let's go ahead and let's see if you get, let me see where you are. Okay, so now get your tool. So you find the spine, come just to the side of it right there. Now you're gonna push the tool this way and push your back down onto it like that. Oh yeah, we've got a spot. Feel it?
Yeah.
Yeah, so it feels a little tight there.
A little bit, yeah.
Yeah, so we're getting right into that little spot there. Now let's go down a little bit inferior to that. So just go a little bit. So lift up your chest a little bit and just go down a little bit inferior to it right there. Yeah. So so keep going. So one thing I saw when you were sitting, you were like slouching like this, right? And these muscles here contradict the slouching because they go like this. They hold you up like this. So if you get these muscles working, so doing this pressure on them and pushing those painful chemicals out and get them to really do their jobs, then you're more likely to have better posture. Keep coming down. So look around for a painful spot. So go ahead, move your tool down. So find your spine, come just a little bit lateral to it, and then press your back down onto it. And then you're going to push the tool this way. And then look for a painful spot. Yeah, so he's found a painful spot. So you know that it shouldn't be painful. So it's, you know, if it was in really good function, it wouldn't be painful.
Okay.
So we're looking to push those painful chemicals out. And so we're preventing back pain by correcting right along the spine here.
Okay.
Yeah. So keep coming on down. I'm going to highlight the area we're treating right now so that you can be looking at it like in the picture as well as doing it on yourself. So you're on that side. So right now, let's see, we're going right along here. And you're using this nice tool, this back knobber tool. And a lot of times, what I do is this now you can get this protocol to give to your friends and all to if you're a therapist to give to your patients. And usually what I do is I highlight the area where I'm training them to do. Then I also draw the picture of the tool that we're using. Now I make a little arrow towards it. So that's the tool that you're using right there. Yeah. And then so that's pretty easy to remember. So how do you like treating that area?
Ooh, it hurts.
Okay, so it's no wonder. Remember, I tried to lift up your skin, and it was all like shrink wrap to your spine. So we're unshrink wrapping your spine there. They're like treating themselves. Now, don't we all want to be? None of us want to have back pain, right? This is how we're all going to prevent ourselves from having back pain. We're going to find the dysfunction, treat it before it becomes a low back pain. Okay, and then it's keeping all our nerves working, and so that's what we're doing. So let's see how far you're down. Now, are you down to the sacrum?
Almost.
Okay, great. Get all the way down. And then go a little bit right onto the sacrum, too. And see, there's a lot of multifidi muscles. So there's a lot of muscle. So here's the sacrum. It starts right here. And you see there's a lot of muscle right here. And so we're going to get down over the sacrum as well. So the multifidis we're on. And of course the rotatories are underneath it. So it's very important to eliminate the pain. You need to work on the underlying perpetuating factors, and one of them is supersensitive spinal segments. And the segments we'd be looking at is T5 to T12 and L1 to L5. And he had all of these. So for him, one of the ways to correct his problem is also to make sure that these nerve roots, these spinal segments are all moving, and that everything is not tight, and that it all moves really well.
Can I do the other side also?
Yes, let's do that. That's what I was going to have you do next. So everybody, next we're going to do the other side.
Can I do it from this?
So you could do it from the same side, but I kind of like this big one, this great big tool like this.
Okay.
And it's easy to get around the person, especially with the hot water bottles underneath. So go ahead and start about here, and get like just find the spine, find and then get just to the side of it. Yeah, great. So tell us how they feel, because it's amazing how painful this is, right?
Yes, this side is a lot more painful.
Yeah, he's just amazed at how much pain he's finding in there. Yeah. So and when we looked at him and we did we tried to pick up the skin. It was like shrink wrapped, so you know that probably the nerve roots are being pressed on slightly by the vertebrae, and when you have slight compression of the nerve roots, it causes heightened tone in all the muscles distribution. So, but if it was completely compressed, it would cause numbness and wasting away of the muscles. Yeah.
Okay.
But if it's slightly compressed, it makes it all hard and dysfunctional.
Okay.
And so that's what we're at. We're at the slightly compressed. But when it's slightly compressed like that, it can be very painful. The muscles can be very painful. You know that you're likely that they're causing trouble if it's painful like this when you treat it. And it feels kind of good when you're laying on the hot water, doesn't it?
Mm-hmm. Yeah.
It feels kind of like you're giving yourself a treat, right? Yeah, like giving yourself a treat. Yeah. Even though it's painful, I mean. Even though it's painful, but it's good though. It feels good though. So would you say that it sort of feels good that you're pressing on it?
Yeah.
Yeah. So it usually feels really good, and then of course if it increases, you know you're doing a good job. If it increases your range of motion, if you can do the thing that you couldn't do before, also if we can pull up the skin, then we know we fixed it. You know, so we know that it's not causing heightened tone in all the muscles distribution. So in this case, it would cause heightened tone in the iliopsoas, the longissimus, the iliocostellus, the lumborum, also the abdominals. It would cause heightened tone in the gluteus medius and the rectus abdominis and the multifidi. So all of those. So we're looking to correct that. One of the things is by correcting the multifidi and the rotatories. So we took a few minutes to treat the psoas. I think we took maybe 5 minutes, maybe 2 minutes on each one. Maybe it took 5 minutes altogether. And we have a lot of more areas to treat here on the multifidi and the rotatories. So it's taking a few more minutes. But what do you think of the time that you're spending on this? Does it feel like it's time well spent?
Yeah.
Good. Okay, so this is our protocol that you're going to be taking home with you. Protocol 16. And I wonder if people know where to find it. Do you think you know this? Do you know where to find it, Stephanie? Oh, tell us how to find it, Stephanie.
Oh, you just go onto the website myopain.com and you click on the body workers, and if you scroll down, there should be an image of the protocols, and you just click on there, and you'll be able to have access to all of it.
What about the pain key?
It's right next to it as well.
The Rosetta Stone of myofascial pain and dysfunction.
Yeah, they're right side by side.
So this here, so you could find, so they're able to find this,
Yes.
and then they could download this and print it, right?
as well.
Great, super.
Glad.
Okay, so you pretty much did it.
Yeah.
Great. Okay, so after we did that, let's see. So we just did the nerve roots now. Let's see if he can pass some of the tests a little bit better than he didn't pass before. We'll just try it, see if it made a difference. So let's go ahead, and we're going to try the knee to the armpit test. So go ahead. Oh, that looks a little better. So it might have been causing heightened tone in the muscles that allow the knee to go to the chest, like the gluteus medius. So did you notice that was better
Yeah.
after you did the spinal roots?
Mm-hmm.
That was interesting, wasn't it?
Yeah.
Yeah. So you always know you're better if you have increased range of motion. So here we're going to just lightly move it, but you know, if you moved it, if you pushed it harder, that would be okay. But this is the way we test it. So 8 inches now on the more stiffer side. Let's try the less stiffer side. And so we're going towards the opposite shoulder, everybody, remember? And here, and again, this is 8. Oh, 8. So we were 11, and now we're 8. Isn't that great? Now let's check this one here and see if no, it didn't change the toe turn. Oh, it did on this one though. Yeah.
Mm-hmm.
Yeah. So we're improving. So we're improving.
Yeah.
Okay. So how are we going to treat the abdominals? let's check those out. So let's see if we can treat the abdominals.
Okay.
And so let's do that next. So let's have you go ahead and lay on your tummy. We'll warm them up. Warm up those abdominals. Go ahead and lay and then turn your head to one side. Let's turn your head. So he's just going to warm them up for a second. So whenever you're working at home, it's nice to use hot water bottles to warm up areas they're going to treat. And let's review the pain pattern one more time. So it causes pain across the hips here, low back hip area. It causes pain across the mid back right here, the low thoracic back. So so the abdominals cause pain in this configuration right here. So we're going to be taking a look at the abdominals treatment. So let's take a look at treating it. So we have a couple different balls. Tell me if this, we'll try a softball for a minute and see how that feels. So let's have you come up on your elbows, a little higher. And let's go ahead and let's get right underneath your rib cage here, and tell me how that ball feels right there.
It's not bad.
It doesn't hurt too much?
No.
Okay, so let's go a little bit lower down, about right there. And you're kind of, so when you're doing this, you're kind of stretching up because you're trying to get before we were getting the psoas, now we're getting the abdominals. So when you do the abdominals, we're stretching it more, and when we're doing the psoas, we're shortening it more. So how's that feel?
A little pressure.
A little bit pressure. Let's go down a little bit more. So let's go down on the one side. Let's do this left side. And we're going to keep coming down the pubis. Yeah. Oh, you're doing it perfectly. Yeah, really good. So this is the more athletic way of doing it. Okay. So this is not the beginner's way, but in the book I have the beginner's way, and then this is the more the advanced way. Okay. Let's go ahead and go down a little lower, and go right above the pubic bone on the left side. What do you think of that?
It's a little more painful.
A little bit more painful there. So that spot, how long do we press on spots that are more painful?
At least 2 breaths.
That's it. Right, Stephanie? Yep. Okay, on the other side, so let's pull that one out. Let's try the harder ball, on the smaller, harder ball on the other side, and just tell me what you think about this one. That one. Okay, so let's go underneath the rib cage there. And then, but press down first, like come right down like that. Yeah, so more on the elbows at first. Yeah. So do it on the other side. Yeah. So how's that feel on that side?
Just pressure, not painful.
Not painful. Okay, so it's not painful. We're going to move on to the next spot. Okay, and then we're going to look for a little bit more, another spot. So come down a little bit more inferior.
No, not bad.
Okay, keep coming down a little bit. So now put it a little bit more on the stretch. So which side did you do before? Now which side are you doing
left
now?
side.
Okay, so now you're doing the right side. So here's a picture of the abdominals, and he's on the right side, and he's about in the middle right here.
That's very painful.
So you're looking to get in between the six packs right there, and you're looking to get through right on the fibers that cause these fibers right here are what cause the pain in the back right there, and this right here. So and then you want to get really low here, and also really high up there. And that's your abdominals, and that helps to bring your torso forward, flexes the torso, assists in breathing, can be part of breathing problems.
Yeah, the side's not as bad.
Okay, good. Okay, and get right above the pubic bone right here, right above the pubic bone. And let's see if you find any spots right there.
Yeah.
Okay, so then once you find a painful spot, you're going to hold it 2 to 5 breaths. So just breathing and relaxing. And then we have one more muscle, only one more muscle to look at for low back pain. We have one more muscle to look at. Okay, so let's see if it's easier to pass some of the tests. Let's go ahead and have you lay on your back again. Let's see how you did on your. Let's see how you're doing on your knee to the armpit test. Whoa, we're getting a little bit better. Okay, so here, knee to the armpit, opposite. Woo, 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 turning into a really, really flexible guy there. Okay, so next we're gonna treat the gluteus medius. And that's right here. So we're gonna do that. Let's do that. We might do it on the floor, but let's start with it on the table so we can just show everybody. I'll do it on the floor while you try it on the table. Okay, so I'm gonna start with. So if you could go ahead and sit on the ball. So we're gonna sit and let's roll around. Let's sit right on the ball. So I'm gonna come down here, get right on the ball. So let's start with just sitting and feel that sit bone, the bone that we sit on, right there. Let's feel that bone, and then let's turn sideways, and we're gonna get right like this, and get right on the gluteus medius. And the trigger points on the gluteus medius are way high up. So let's start on the greater trochanter and the hip bone, this part that's right there, and let's push up, up, up to the top of the ilium right here. And that's where our trigger points are, right there, right there. So let's go ahead. Let's go back to the greater trochanter. Now that gets a little bit more posterior, and we're gonna get right. So we're gonna like iron it down or up, I mean, to the top of the ilium there. How's it feel, Peter?
It's painful.
Oh, good. So we're gonna hold that for a few breaths. So whenever it's painful, we're gonna hold it for 2 to 5 breaths, breathing and relaxing. Okay, let's go again, down to the greater trochanter, and then up to the ilium, and look around for some painful spots. And see if you find a painful spot, and get right onto it. So again, look around. Let's go a little bit more anterior too, and let's see, but really high up on the hip. Let's look for a couple painful spots. See if you find a painful spot. Look around. Now, what do you think? Can you find a few?
Yeah.
Okay, so you're on a kind of a softer surface. So this is like a bed, a little bit softer surface. But to go in a little deeper, like you might want to do in a few weeks, you could do it more on the floor, on a hard floor like this.
Okay.
And then, so if it's too painful, you can always go with a softer ball too, But it's not too painful, is it?
It's tolerable.
It's tolerable. You can do it. Okay, let's try it on the other side. Let me review it with you on the other side. So this is the last muscle, Justin, and the last side. What do you think of that, Justin?
Excellent.
Okay, so first on it, then you're going to go sideways and come all the way and so you're going from this part here, which is called the greater trochanter, and then you're ironing it up to the top of the ilium, and you're capturing the trigger points right there next to the ilium, like on the top part of the hip.
Mm-hmm.
And then you come down and you get there, and then you come this way, and then this way, kind of like a fan. He found the spot. He's found the spot. So after we've treated it, we could also lay in the hot water bottles. We could take a bath, move, so those are all things that we can do. We can heat before, we can heat after. So, we'll reward ourselves with heat. It's good. So then we're going to test again, see how good we did.
Okay.
Okay, let's go ahead and lay on your back again and see if we did anything. Okay. All right. So here, we're going to go test. See? Whoa, we're doing really good there.
No, that's a lot
better. Okay, so that's better. That's pretty good. And so let's try it on the other side. Good. Oh, outstanding. Okay, so now another way to keep getting better would be to also do a little bit of resistance. And so what we have you to go ahead and hold on to your leg. Now go ahead and resist towards Stephanie over there. So push your leg that way towards Stephanie. Push, and relax, and bring it towards your shoulder. Then push towards Stephanie. Push, and then relax and bring it towards your shoulder. And then push towards Stephanie. Good. Great. Nice. Let's try it on the other side. Bring your knee towards your opposite shoulder. And then you're going to go ahead and push towards me. Push. Keep pushing, keep pushing, keep pushing. Push, 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 and relax. And push towards me. So during the whole treatment, I'm trying to get you to pass the range of motion tests. And push towards me. So all the treatment and all the stretching and everything is designed to get you to pass all the range of motion tests. And generally, if you can pass the range of motion test, you're most likely pain free. Okay. So here we're gonna check here. Okay, that's better. So that's about an inch better. Let's check on this side. Oh, that's about an inch better too. So that's good. So those are 2 range of motion tests of 2 feet. And then here we did this one. So we're good. So this is. So when you treat, at least if you treat yourself and you get at least a third better, oh, that's really good. What if you get 50% better? Oh, that's super great. But what if you get better than 50%? Oh, that's outstanding. And so that's good. That's you. You're doing really, really well. So you did outstanding. Well, didn't he do good?
Yeah.
Okay, so now we're going to take a little break.
Okay.
And so then we'll come back. We'll do a couple more things.
Cool.
Okay, so let's take a little break, and everybody will do a little bit of range of motion exercise. Okay, so we're going to do some range of motion exercises. It's always nice to have like a nice beat, so some music that you like, whatever, something you like but has a nice beat. So whatever you like is probably the most important thing. And so here we're going to do some range of motion exercises for the psoas. So could you get a little closer than the other? Okay, good. All right, so take a look here. So here's we're going to do some range of motion exercises for the psoas, and here this would be taking big steps. This is doing hip twist. Here we're going to, this is the all fours series, walking with your toes in and out. This one here on a chair. So here we could do the torso bend and extend series, and also pelvic tilts. So these are all good for the psoas. Next muscle we're going to look at here is the paraspinals, and we could do the cat back and the old horse for the paraspinals, seated or on all fours. We can do the superwoman or superman exercise, and we could do the on the ball or not. Then we could also do the thread the needle, and we could do the torso rotation and reach series or the standing bend series. And there's quite a few more, but those are ones that we put here in the low back book. The abdominals, again, we could do the pelvic tilt, seated or standing. We could do the thread the needle. So these are all, this is the standing bend. So a lot of this, many of these muscles, cat back and old horse. And then again, the quadriceps we'll do when we do the protocol 18. So that's when we do the, so here for the gluteal muscles, we're gonna do the grapevine. We're going to do the standing hip twist, and we're going to do the big steps. So those are some of the ones that we'll be doing for the gluteal muscles. We can also do this nice leg swings, toes in and toes out. Okay, so let's put a little music on, and then we'll do some of those exercises. So range of motion exercises for all the muscles of pain and the low back pain. Okay, let's go ahead and let's stand up. Let's take a look at doing some nice range of motion exercises. I'll move this table over just a little bit. So let's do some pelvic tilts. So for this, let's go ahead and bend our knees. So everybody, we're going to bend our knees. We're going to push our pelvis forward, and then we're going to push our pelvis back. And this, but our torso stays still. So this part of us stays still, and the pelvis moves. Pelvis forward, pelvis back, pelvis forward and back, pelvis side, side. Side, side, and side, and forward for 2, 3, 4, 5, 6, 7, 8. Now to the right. 1, 2, 3, 4, 5, 6, 7. That's it. 8. The other side. 1, 2, 3, 4, 5, 6, 7, 8. Now we're going to go back, and we're going to push our hips back. So 1, 2, 3, 4, 5, 6, 7, and 8. So that's like your pelvic tilts, and we're going to go ahead and move that around to and then move around the other way. And for our back muscles here, we're going to extend, go back, and then we're going to go forward and touch our knee.
Leslie asked which
And then-
muscle is this for?
Oh, which muscle? This is for the abdominals and for the back muscles, for the paraspinals, the longissimus, the iliocostalis, and the multifidus rotatories. And we're going to go back and look at our arms. And we're going to come down, let's touch our toe. And come back. And we're going to touch our toe. And back. Good. Okay, so let's do something. So we did a little bit for, let's do a little bit for the psoas. So we're going to go ahead and lunge forward. And again, the other leg. And the left leg. And the right leg. And the left leg. And the right leg. Good. So here we're going to go up with our toes in. This is good for the psoas. So we'll say the muscle that we're working on while we're doing it. Psoas.
Psoas.
We're stretching psoas.
Stretching psoas.
Now we're stretching the gluteus medius. Toes in. Contracting gluteus medius. Stretching gluteus medius. Contracting gluteus medius. Stretching.
Gluteus medius.
Contracting gluteus medius. Okay, so we're going to do the grapevine. So walk this way. So let's start with the right foot. We're going to go to the right. So right, left over right, left behind right. So this is good for the gluteus medius. So let's just walk. Let's stand straight like this. Now let's walk. Take a step like this and then stretch. That stretches our gluteus medius right there. Good, you're doing it good. And let's go ahead, step. Let's do our other gluteus medius. Right here. So a good way to stretch it is walking sideways like this. And a good way to get our psoas is to take big steps. And we can get our psoas and our gluteus medius and minimus by walking with our toes in and toes out. Good. So another way we're doing a good job with our psoas is taking a really big step and then taking the leg back. Taking a really big step and then taking the leg back. So those would be good ways. So we get a lot of so for our abdominals, let's go ahead and take a stretch back and like get our arms, take it back, and let's take the other side back. Let's stretch our abdominals, and let's stretch our abdominals. Let's go all the way and shorten them, all the way, and stretch them, and go all the way and shorten them. Okay, so when we did the pelvic tilts, we were doing the paraspinals, the abdominals, and the psoas, and we were using the glutes. We were doing all the muscles that cause low back pain. We could rotate a little bit to get the multifidus. So for that, we could go ahead and rotate and bend the knees and come on down and a little higher. Great. Okay, we got a little movement in. That was good. Okay, so what do you think about it? Was those movements too easy? Do you feel like they're too easy?
No, they were fine.
They were good? They're not too easy? Okay, good.
They were fine.
Just need to turn the volume up, I think, a little bit.
Okay, so let's see if we had any improvements. Okay, so let's look at any improvements since we started. Okay, so now after we treated some of the muscles, he's symmetrical.
Yeah.
That was good, right? He's symmetrical.
Just scroll.
Okay, so that was good.
Yeah, good.
Okay, and then next we were trying to get these muscles to lift up, and look at they're lifting up now. Okay, so that's good, right? So just lift, okay, like that. Okay, so here they're lifting up pretty good, but they're still getting a little bit, quite a bit of compression right here. Feel that's kind of tight?
Yeah.
Yeah, so that's a little bit too tight there. So probably be good if I took a look at that. Yeah.
Right.
So here you can see it's too tight. Would it be okay if we took off your look without your shirt? Yeah. Okay, great. So let me put it right over here. Okay, so here you can see that. So right here we have some skin. The skin comes up, but right here you can see the skin is not coming up. It doesn't want. Oh, it's really tight. So we want to correct that. See, it's really tight there. Okay, go ahead, just stand straight. Yeah. So here, so a little bit too tight right here. So, but especially on that spot right there. So let's check that. And let's also do another really interesting underlying perpetuating factor. Also, let's just see if the abdominals might be pulling him forward. So let's go ahead and stand straight. Okay, so we got your, let's see if the abdominals might be pulling you forward. So here's a really good treatment for the abdominals. Aha, they are pulling you forward. Can you feel it? Yeah, okay, you try it, you try it. So here, so just feel, lean forward and grab the abdominals a little bit, and then lean back. You see? See how it's see it's not letting you stay straight?
Yeah.
You can feel it, can't you? So I can feel it. It's like they're pulling you forward. Like, it's nice to have them strong, but you don't want them pulling you forward, because then you have to use these muscles constantly to contradict the forward pull.
Okay.
And then they can give you your neck, cause your neck to be in pain. So this is a really great way of you learning how to treat the abdominals. Would be to go grab them and then pull back and feel how they don't pull you forward. Okay, you try it on that side. So go ahead and lean forward, grab them more, like grab more. Yeah, yeah. Now see how when you lean back a little bit, how they pull?
Yeah.
Yeah. It's not supposed to be pulling you forward like that.
Okay.
Yeah, so that would be, so you want to grab them. So how painful is that?
That's pretty painful.
Okay, that's his reluctance in grabbing more. Okay, so let's do some light treatment on it, but that shows that that's pulling you forward and probably causing you to have some back pain and some neck pain, you know.
Okay.
So it'd be good. Let's treat that a little bit lightly, and then let's go back again and see if it's still pulling you forward, okay?
Okay.
Okay, let's go ahead and lay on your back. So we'll do a little abdominals, and we'll do a little bit of the low back muscles, and see if we can get the spinal roots to improve.
Are you going to treat the psoas at all too? Or?
Oh yeah, we'll do it. We'll have to do it.
Good, yeah.
Okay, so we already checked him a few minutes ago when we saw that he was down to 8. And
Yeah.
then we'll see if he gets down to 5 or something like that.
Okay.
So let's treat the abdominals. So how comfortable are you?
I'm comfortable.
Pretty comfortable? Great. Okay, so let me put a little bit of a towel here. So sometimes if you use your abdominals a lot and they get a little bit sore, anytime your abdominals are sore, they're going to heal. But then what if you sat like this after they were sore?
Yeah.
Or you slept in the fetal position after they were sore, and you used it. Maybe you used them a lot for breakdancing or something. And then they could heal in the short position. And then when you stand up, they're constantly pulling you forward.
Yeah.
Okay, so
Makes sense.
they could get stuck like that. So let's see what we can do. Make them nice and flexible. And since it was so painful, I'll do something not so painful. Okay.
Sounds good.
Oh. So, what does it indicate when it's painful when you press on some taut bands of muscle and it's painful? Indicates that there's painful chemicals like pickled in the muscle, like stuck in the muscles. So I'm giving it a little bit of pressure. What do you think of the pressure of that painfulness of that pressure?
It's a little.
A little bit hurts. Okay. well then we know that this is bothering you. Yeah, this one here. So I'm giving it not very much pressure. I'm right on rectus abdominis. So I'm doing compression. So here is the linea alba here, and I'm just to the side of it here, and I can feel some taut bands right in here. So I'm giving them kind of a light pressure, but I'm right on the abdominals. So right next to the umbilicus. So right here are some fibers. I can feel some fibers right here and right here. So what we want to do is make sure all these fibers are nice and flexible and none of them are painful to the touch.
Okay.
Let's go ahead and let's get right underneath the ribs, right where the rectus abdominis attaches on the ribs. Okay, a little lighter pressure. A little bit lighter. So getting right in there. Now after treatment, if it's kind of painful to be treated, sometimes it's slightly, it could be just like with exercise, you could be a little sore after treatment.
Okay.
Or you might not be sore at all. You know, so it's possible you'd be sore or you may not be sore at all. So you just could keep that in mind. If you are sore, you want to keep moving, keep massaging, keep putting heat on, and not heal. So it's going to heal. If it's sore, it's going to heal. And we want it to heal in every position and not in the short position, right? We want to have every range of motion. So here, we're going to treat so this section we were on here would be causing the pain in this section of the back up here.
Okay.
And then now we're going to go lower, and this would be causing the pain across the low back, right here.
Okay.
So this is the next little section we're going to be on. So it was good we took a look at the abdominals.
Mm-hmm.
Yeah, they were good. That was good to look at them. So this is your core muscles, and they're a little bit too painful. Yeah. So to prevent low back pain, it'd be good to get these just a little bit in better shape. So those of you that treat patients or like to treat your family, this is a good way. You could start on the abdominals, and then the next one you might treat is the psoas. So let's go ahead. Let's go just below the belly button on the left side. So let's find the umbilicus and come just to the side of it, and I find some taut bands right there. You can feel them, right?
Yeah.
Yes, he feels them. He feels them. Yes. Mm-hmm. Now, when you're laying flat like this, you're stretching the abdominals just a little bit, especially if they're tight.
Yeah.
So I'm getting right on the taut band, so I can feel the taut band right there. So I'm getting right on it, and we're both breathing and relaxing, and breathing and relaxing. Let's feel you do inhale, tummy goes out, and exhale, tummy goes in. Inhale, tummy goes out. Good. You can do it.
Yep, that's good.
You did it. Now we're going lower. So I found some taut bands right here. So I'm going to just, and he notices them a lot. Okay, so I'm just coming back to those taut bands right there. Oh, it's almost, we're getting close to the end.
Well,
We better,
say it at 5. We still got 25 minutes.
we still have 25 minutes. Okay, so here I got a few, so here we improve those taut bands a little bit, but remember we want to get really low, right above the pubis, okay?
Okay.
So here we're going to go feel the pubis and go down and press, so you're going to touch, so here we treated the attachment of the abdominals right under the rib cage and on the xiphoid, and then also down here where it attaches onto the pubis. This is some of the, it's good to treat the whole thing.
Yep.
In between all the six pack, you know, between all the fascia, and then treat all the little taut bands, and also treat right above the pubis. Okay, let's give that a good massage. So you could imagine that you could treat it this way. So you could come along, you can find the center, come just to the side, press in, and also you could also press in and come up on the attachments under the ribs like that. So this would be a good way of treating yourself too, just right here on the abdominals. Now next one we're going to look at is the psoas.
The psoas.
Okay, so here it attaches, remember, on about T12 and then L1, 2, 3, 4, and 5. So it's here underneath the abdominals. So I'm going to treat the right side first here. So I'm going to find the umbilicus, come to the side, and then I'm going to come in and towards the spine. So I think I'm going to, because the abdominals are tight, I'm going to take a little stretch out of them. So we're going to bend the knees. Okay. So we're going to get a little bit deeper by getting underneath. Okay. What do you think of that spot?
It's painful.
Painful there. So we're looking at the iliopsoas and going underneath the abdominals. So we're doing a little bit of the iliopsoas here, and then we're going to get at the iliacus, remember? And we're going to also treat the nerve, the cutaneous femoral nerve as well. So we're finding a few taut bands in here, right there, right? Mm-hmm. Taut, a little bit painful. And if we've been sitting, what's the likelihood of a person having a problem with this? Pretty likely. So we have Stephanie. She's doing a little bit of the psoas right now. So this is the beginner way of doing the psoas when you're working on yourself. You use the larger ball and you work on the wall, not on the floor, and that really helps to that's a good beginning. A good beginning. So you're treating it while you're stretching it a little bit, and while you're standing. Okay, next I'm going to come into the iliacus. So I'm going to pick up this leg. I'm going to take a little bit more off the stretch, and I'm going to get way in here. So let's take here so you can see what I'm doing. So here I'm going to go this way, then I'm going to go that way, then I'm going to go this way, then I'm going to go that way. So we're going to get at the iliacus, and this is the part that goes and bothers the nerve that we've been talking about. So you could call it the nerve that causes tingling on the outside of the thigh. That's the name of that nerve.
That's the official name.
That's the official name. It's the nerve that causes the pain of the tingling on the outside of the thigh. Yeah, this one's bothering. Yeah. Okay. So here it is. We're treating it. So go ahead and press your leg towards my hand here. Press this way and relax. I'll press this way and relax.
Can we see where your hand is a little bit better?
So it's yep, there it is. It's so I'm going this way, this way, this way, and this way. So I'm going deep into the hip, and it's way below the intestines. It's just mostly into the iliacus. Okay, push towards Children's Hospital over there.
Does he know where Children's Hospital is?
Relax.
Toward the window.
And towards Children's Hospital. And relax. And push that way towards the dental college there. And relax.
You have to know your landmarks when you come here.
Okay, now towards the Ellerton Hotel. Push right here. Yeah, relax. Good. Okay, let's take a look at the other side. So let's go ahead here. So we're going to look at find the umbilicus. So we're going to come just to the side of it. So you're going to feel our abdominals. We could go through the abdominals if they weren't very tight, but if they're a little tight, maybe we want to go around the rectus abdominis and underneath it. And so also let's do it. Let's take the rectus abdominis and make it a little shorter. Okay. All right. What do you think?
Yeah, it's pretty painful.
Okay, you notice it there. Yeah. So I'm just holding it. So one way of treating it is one finger is treating, but the other two fingers are helping. And then relax. And I'm going to come down a little. So I'm taking the abdominals out by bringing the knee up and coming down and a little bit lateral. And then now we're coming into the iliacus. So for here, we're pressing lateral and bringing the knee medial. Okay, so press your knee towards me, push, and relax. and push, and relax. And this is the more painful side.
Yeah.
And push, and relax. Okay. And push towards me, and relax. And this is all probably from sitting. What do you think? Do you think it's from sitting?
I'll take your word for it.
What else could it be from?
Sleeping funny.
Could be from sleeping funny, right? Right. What else could it be from? Did you have like an injury?
Yeah, when I was like 17.
What kind of injury was that?
I tried to do a backflip and I just twisted my back in a funny way.
Yeah, so it got sort of twisted in a funny way once.
Yeah, and
That
ever
could have
since
done it.
then, yeah.
So ever since then, so that was when you were 17, and that's about what,
Like
8 years ago?
7 years.
6,
ago.
7 years ago.
Yeah,
Okay.
7 years ago.
Yeah, so it's a few years ago. So sometimes some things, little injuries that we might have, if we don't fix them, we could take them with us our whole life. That's a long time. So it's good to get rid of them before we get any older, right? That's good. Don't take it with us our whole life. Okay, so see how we're coming? Oh, coming pretty close. Coming close. Looking good. Looking good. So I'm going to treat the gluteus medius and minimus a little bit while I'm stretching it. So here, I'm putting it a little bit on the stretch. So remember, it attaches here, and then it attaches over here on the ilium, and then onto the greater trochanter. So I'm just going to stretch it a little bit while I'm treating it. Push towards me a little, and relax, and push towards me. Good. So it's coming along pretty good. Okay, so you want to keep getting it closer and closer and closer to your chest. Okay, so I'm going to stretch it really good. So let's just go ahead and lay on your tummy, and we'll give it a really good stretch. So this is a good stretch, but remember we took big steps, remember? And we also did a couple of other just lunges, but this is a great stretch too. So this would be if someone else was stretching you. So you go ahead and you put one arm underneath the leg, one elbow on the hip, and then you're gonna push down on the hip. Yeah, let your head rest, yeah. And then you're gonna push down on the hip and pull the leg up. So now resist and push your leg down towards the table, push. Keep pushing, harder, harder, push, 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 and relax. And push, keep pushing, keep pushing, keep pushing, keep pushing, keep pushing, and relax. Good. And push, keep pushing, and relax. Good. Let's see. Well, that's good. Now your heel is coming to your seat. So we from treating the back and other things, your quad muscles got longer. Okay, let's do a little bit on this side. So again, we're going to push down on this side and pull up. So we're going to get underneath, above the knee. Yeah, that's good. So we're going to press here, we're going to grab here, we're going to lift up, put our knee here, and then he's going to press down for a count of 15. Go ahead and push down, push, push, push. And relax. And go ahead and push down towards the table, push. A little bit less there, okay, about right there. Yeah, push. And relax, good. So I'm gonna test, let's see, right, oh, it's almost passing. So just like 3 fingers, so that was pretty good earlier. All right, let's go ahead and have you lay on your back one more time. Okay, so here, let's loosen up your pants just a little. Okay, great. So we're coming down there. We're getting closer. So it's each day, maybe over time, get it all the way to your chest, especially going towards the opposite shoulder.
Okay.
So let's go. We'll just measure once, and we'll see how good we did. So how good did we do, Stephanie?
It looks a lot better than it was before.
Okay, here we got it down to 7 inches. Okay, so that was good. So we started at 11, down to 7. So it's like at least a third.
Very
right?
good.
So a third is good.
Yes.
So I always like to get a third or a half or completely gone. Okay, so this is eight inches on this side. Okay, so that's very good. So we just let's see if we can get it down to 5 inches. Okay. All right. So we also wanted to see if you could turn your toe in. So let's see if we can do that. Go here. So this could still improve, and let's see how we did on this side. This side's pretty good. So this side here, maybe we can do a little bit more to improve this side.
Okay.
Okay, so let's have you go ahead and turn. Let's have you go ahead and sit up and then stand up. Good, and then go ahead and stand up. And we're going to treat that hip. So we like to use the body support system, and we're going to have them lay sideways. So let's have the right hip up. So let's put your left shoulder in the little crevice here. Can I have the neck roll? Okay, and put your shoulder right here. Yeah. So this is great. See how when you're sleeping, you could have your shoulders someplace. If you're able to, get a little bit of something here so that your shoulder has a good spot. Okay. So let's go ahead. We're going to take a look at the gluteus medius right here. So the gluteus medius trigger points tend to be up high, way up high, like right here. So we're going to start a couple inches below the iliac crest and look for taut bands up high. And he finds them. They're there. He agrees that they're there. Okay, and I'm going to come. So again, here, look for some taut bands, like right there. I can feel them right there. And we're going to press in and capture them up against the iliac crest. What do you think of that one?
He's just laughing through it.
Okay, so here again, here we feel some right there. I can feel it right there, some taut bands. So you can go ahead, and I'm going to grab it and press it up towards the iliac crest. And you know that this is the exercise for this is to walk with your toes in and toes out and do the grapevine. And you know that you're doing good when you can turn your toe all the way in. Okay? So let's go ahead and lay on your back one more time, see if we improved it, okay?
Okay.
So go ahead and lay on your back, and let's see if it wants to. Oh, it wants to go in better. So I'm doing that. So it's good. That's good. So it's good. So that's great. So that's a start. That's a start on that one. So you're starting to get better. And how does the tingling feel? The little tingly feeling that you had?
I'm not noticing it now.
No tingly feeling now. Okay. All right. So we got rid of that. So how frequently do you think that? So you saw what we did today.
Mm-hmm.
Do you think you could do that on yourself every day?
Yeah.
Every other day?
Maybe every other day.
Okay, so how could you fit it into your routine?
Just before sleep, probably.
So before you go to bed, you might like to do it.
Or maybe when I wake up.
Okay, so maybe before when you wake up or when you go to bed. Yeah, I like that. Yeah. So if you're not getting enough progress, you might do it twice a day. Okay, but if you're getting enough progress with the morning or the evening every other day, then good, then you're good. But I would say it would be good to do it probably at times if you get more in, that would be good, better. So maybe if you get it in once a day or twice a day, that would be good.
Okay.
Yeah. So you could treat the abdominals, you could treat the psoas, you could treat the glute muscle, right? You could treat the muscles right along the spine. You could treat the muscles a little bit further away from the spine. Now, let's take a look at how to treat the muscles a little bit further away from the spine. Those up and down muscles. Okay. And let's go ahead and roll to one side, and then let's have you go ahead and stand up. So I'm going to treat them on you first, and then I'm going to have you learn to treat them. So let's go ahead and have you stand up. So I'm going to treat you a little bit while you're stretching. Now we were saying that we wanted to treat the front muscles more than the back muscles because everybody treats the back muscles. But we're going to treat we do something special. We're going to treat the back muscles while we're stretching them. Okay. So if you can come like this and lean forward, put your head here like this. So go ahead and lean forward, like that, and let your head rest there. Yeah. How's that feel?
That's fine.
Okay, so let's look at this is the longissus muscle. You can see it stick. Oh, you can feel it.
Yeah.
He feels it. Yeah.
Sharon, if someone didn't have the luxury of a high-low table, how might they do this? Could they put a pillow under the knees and they could have them kneel over a short table, or maybe it would have to be
No, you just look at, you can put the, if this were, you could use the body support system.
the body support
Yeah,
system.
so let's have you stand up one more
He's
time.
on that right now.
Yeah.
So you could double it up. So if the table were lower,
Uh-huh.
you could double it up like this. You know, so if you had the table not so high as I have it,
Yeah.
you could double it up like that. And then, Stephanie, do you know where the face cradle is?
Yeah, because guys, you can't forget, like the difference between getting great results and getting pretty good results are these things,
So
like
come over,
treating
Peter.
on the
Come on this
stretch.
way. Yeah. So go ahead and lean forward and put your head here. So this is another way of doing it. It's coming this way, like that. So
Yeah.
so this would be like a table you might have lower, and
Yeah.
then you could put some pillows underneath, and then you can see here that you can see the longissimus and the iliocostalis are bothering him a little bit. You can see they're sticking out right there,
Wow.
right there. Yeah. So let's go ahead and we'll treat him with the stretching.
Do you guys see the
Are you
difference?
pretty comfortable, or should I make
Yeah.
the table a little
No,
higher?
I'm fine.
You're good? Okay, so we're going to use our elbow for this. We're going to find the spine, come just lateral to it, and then we're going to press in. So first you're going to just touch. So touch. Then you're going to go down till you feel like a little bit of resistance. I feel a little resistance right there, don't you? Yeah, he notices it, yeah.
And
And then I'm going to come up. So find the spine, come a little bit away from it, and you can feel the band right there. So then you're going to just press, you touch it, and then press, and now you stop as soon as you feel the resistance. That's about good there, right?
Yep.
and if you wanted less sharp contact, you could extend the arm a little bit.
You could go a little bit more. You could be more like this. You could be,
Uh-huh.
you could press more like
Yep.
your whole forearm. Could
Yep.
press like that. Yeah.
Yeah, it's a little broader like that too.
Mhm, that'd be a good way too.
So you guys see how those muscles popped up when he was on the stretch? You see, that's so critical to treat on the stretch, and when you treat it in the psoas, you treat, especially in psoas, what do you treat? In the short. The psoas especially needs to be treated in the short position.
Because it always
So,
gets stuck and won't
Gets
shorten.
stuck. And the other one
Yeah.
is like that, is that crook in the neck muscle.
Mm-hmm.
Who for $1 million Monopoly dollars can tell me which is the crook in the neck muscle? The levator scapula. Yeah, good.
Okay, so here again, you see the longissimus is pretty tight and the iliocostalis right here, both. So we'll get a little bit of both of them here. So we're going to feel the spine. Start up here. I'm going to feel the spine come a little bit lateral, and I'm going to get both of them with the forearm like that. So I'm going to push down at the same time while I'm stretching up here. So we're getting close. It's just 5 more minutes, Justin.
5 more minutes, yeah.
Just 5 more minutes, Peter. Okay, so here we're stretching it. So he's leaning forward, and I'm actually giving some pressure down here as well.
Yeah.
So we're finding taut bands, and we're pressing on them. We're pushing those painful chemicals out, and we're passively allowing the blood supply to get in. Now we found the tight spot. What do you think? Okay, so when you're doing this, if you could turn your head that way, so that actually you get all the way, the iliocostalis comes all the way like this, from the base of the skull all the way, the longissimus and the iliocostalis together. Yeah, you're right on it, yeah. He's right on it now. It was a little bit more painful on the right side, wasn't it?
No, this side is...
This one's worse, okay. Oh yeah, here I've got a band right here.
Wow.
I can feel it right there. So we're giving it a really good stretch with his head also like that. Okay, let's have you go ahead and stand up. And then I'm gonna if you could just leave your hips really close to the table, like anchor them there. Okay, now I'm gonna take a look and see, and you can see that he's probably hypermobile, but not in the spots we were treating.
What does that mean?
Probably you're very flexible, but I didn't check you for that. But we found a lot of spots that weren't very mobile. Oh man, this is good. Look at now your muscles are they're moving. All these muscles are. Let's see on this side. It's still a little tighter on that side, but I got it moving pretty good. So how can you treat these? You can put a ball on the wall, and then you can press in and work with them, or you can do it like we did on the table with the tool underneath you.
Okay.
Okay. All right. So we did it. Now next week we're doing number 17.
That question,
why don't you put your shirt
answer to the
on?
question was the reason why Sharon had her hand on the sacrum or the ilium was to give, to further stretch, exactly
Right.
as our friend just answered for us. Great, you guys
Great.
already answering the questions.
Oh, good. So if one person asks the question, it's great. If someone else answers it, that's wonderful.
Yeah, that's wonderful.
So next time, we're going to be working on 17.
Yeah.
So this would be abdominal pain. And we're going to really work at rectus abdominis again, which will be great. Then we're going to also be working on the abdominal obliques, then also the transverse abdominals, the ilicostalis thoracis, also the multifidus again, and the pyramidus. We didn't treat that one today.
Yeah.
And also the quadratus lumborum, which will be a lot of fun.
Yeah, so we didn't do the QL today either, right?
Well, no, we weren't. No, that's because that causes more abdominal pain and low back